Well, welcome back. Today we have another special edition of Healthline 3, and today we are welcoming a new face to our family, Dr. Saimah Talukder, and she is an OB-GYN with Willis-Knighton Piermont. We are so excited to have you here on board.
Thank you, Luana. So happy to be here.
Well, this is a big topic. We often don't think about pregnancy and women who have COVID-19 and the infection rates. We kind of think of them as being just different because it doesn't affect and impact everyone. Right. But they do get infected with it, and it really impacts them quite differently. Tell us about that.
No, certainly. We know that COVID-19 is predominantly a respiratory virus. So with that, as the baby is growing inside the mom's belly, the baby pushes up on the lungs and then may cause respiratory compromise. As a result, women may need hospitalization, they need ICU admissions, often ventilation, and possibly preterm delivery as a way of saving the mom and the baby. So that is something that we really need to look out for. The good thing is, however, that pregnant women are not more likely to get the virus. They can become sicker, but are not more likely to get the virus.
Have we seen any death rates in women who have, had complications giving birth as a result of COVID?
I have personally not.
Okay.
In our health system, we have had very few mortalities, which is very reassuring.
Very good news there.
Yes.
But obviously, like you said, this can happen. The good news is there's light at the end of the tunnel with this COVID-19 vaccine, and I know you're excited about that.
No, I am. Since the COVID-19 vaccination has come about, I have been so excited. Half of my consultation at the moment is actually encouraging all my patients, not just pregnant moms, my gynecological patients as well, to really promote the vaccine. I feel that this is the only way that we're going to come out of this pandemic that we've been going through for the past year.
Do you get a lot of patients who are nervous because they are pregnant and getting the vaccine, and maybe the adverse reactions that they could have would impact the baby?
Yes, no, certainly. And this being a relatively new virus, we still haven't really had all the data that we can from the vaccination. We do have a tool now, however, that any woman who is vaccinated, pregnant woman, they can register in something called vSafe. And this is a smartphone application where every week the woman will be texted to see whether she's developed any signs or symptoms, any adverse effects.
I think we mentioned that during our newscast. You may have heard it briefly, but I wasn't understanding it at first. So this is an actual app to kind of track how she's doing.
Yes.
To really get that data that they're looking for.
Yes, absolutely. The vSafe, it's actually available for everyone who has been vaccinated, but there is one specifically for pregnant women, and they do separately need to register for this. And as a result, the New England Journal of Medicine, just yesterday, they did actually put out some data about the safety of the vaccine. Between December the 15th, 2020 to February, they looked at about 35,000 women registered as being pregnant, and of those, just over 4,000 actually registered for the vSafe pregnancy registry.
Oh, good.
And with that, the results have been good, because the chances of miscarriage, preterm delivery, intrauterine growth restriction of the baby, they are really similar to those in moms even before the COVID vaccine was introduced.
So we know that there's been a lot of talk right now, especially with the Johnson & Johnson vaccine kind of being pulled from the clinics,
Yes.
not really being allowed to be used. What do you have to say to maybe calm any fears or to really put any caution or warning out there this afternoon?
Right. So the Johnson & Johnson vaccine was introduced as an emergency use authorization in mid-February, at the end of February. And then only recently, on April the 13th, the CDC and the FDA, they actually have, as you said, put a hold on the administration of that. And that is because out of 6.8 million people who have been vaccinated, there were 6 cases of a very rare condition called cerebral venous sinus thrombosis, which as a result, from those 6 cases, 1 person has passed away. Unfortunately, the cases, they were all in women between the ages of 18 and 48. However, it's really difficult, it's still early to say whether the actual vaccine was the cause of the thrombosis.
Right, because it's so rare, 6 of thousands.
Yes, so 1 in a million chance. And that's...
you have a better chance of being struck by lightning, probably.
Absolutely. And it may have been something that these women had a predilection for anyway, that they may have developed this. But until further investigation is done, this has been stopped. The administration.
For those who have already received the Johnson & Johnson vaccine, are pregnant,
yes.
Do you have anything that they should be alarmed or concerned about right now?
I wouldn't worry about it at this time. The women who did end up getting the thrombosis, they were between 6 days and 14 days after the vaccine. So if you are beyond that, I wouldn't really worry. It is still good to put caution to up to 3 weeks post-vaccination, and just to keep an eye out for any visual symptoms, really bad headaches, abdominal symptoms, possible leg pain. And if you have any of those, then really call your provider and go and see them.
Notify your OB-GYN immediately. Dr. Talukder, this is difficult for me because within several groups across our country in particular, there have been all these conspiracy theories that the vaccine is going to change the DNA, the vaccine is going to do this, they're trying to control you. What can you say as a physician, as someone who knows what is going on from a scientific background? Why is that not true?
The COVID, and that is really a great question, and this is the reason why people are so hesitant to get the vaccine. The COVID-19 vaccinations are, the ones, Moderna and the Pfizer, are messenger RNA vaccines. Now, the way that they were designed, when a small particle of the messenger RNA is placed within the vaccine and then injected, it does not enter the nucleus of the cell. And as a result, the DNA cannot be affected at all. Another thing is that it is not a live vaccine. We have traditionally, historically, vaccinated women in pregnancy. We give them the flu vaccine seasonally. We also give them the Tdap vaccine, which is that to prevent pertussis. We know that there is a epidemic of whooping cough in the country, in the US. And as a result, any time between weeks 27 to 36, we do recommend giving the Tdap vaccine.
So the Tdap, am I saying
Tdap, the tetanus, diphtheria, and pertussis. So the reason we give this vaccine is for the pertussis part, and that is whooping cough. So to give moms passive immunity to the baby, because babies aren't vaccinated until they turn 2 to 3 months.
Right.
So just as a protection, if we vaccinate moms in those during that time, then we hopefully are imparting passive
baby will
immunity.
get that as
the
well.
baby will indirectly. And that's the same for the COVID vaccine. The studies have now shown that the COVID vaccine, moms who are given it, especially in the 3rd trimester, the babies are born with the antibodies, which is such a protective mechanism.
The Tdap, when you mentioned that, is that the same? Is it designed the same way as the COVID vaccine?
No, the COVID vaccine are really the first messenger RNA vaccines.
Okay.
We do have some, historically, we do have similar vaccines, such as the Ebola vaccination studies, and those were actually given to pregnant women. And we found no problems in giving those vaccines in the past.
So no issues, no complications there. This, let's talk about the benefit outweighing the risk. What, you know, we know that this is such a hot topic. It's very emotional for me because I'd much rather see someone be vaccinated, preventing themselves and others from getting sick. But a lot of people are choosing not to do that. That is their choice.
Yes,
I don't want to put them down in any way, shape, or form. But if if we were to look in the bigger, grander scope of things, why is the benefit far greater than the risk?
The reason is that we have been in this pandemic for almost 15 months, and the only way that we are going to really be able to get out of this is something called herd immunity. And we need to make sure that everyone around us is safe and not being able to spread the virus. So the only way that we are going to achieve this herd immunity is by immunizing at least 70% of the population.
And we know 50%, I believe, is already now.
At the moment, it's almost, yes, we're just over 40% have had at least one vaccination, and 25% have actually been fully vaccinated.
For those who might be a little concerned right now about baby, and I like what you already mentioned, their mom, what we're seeing when they do get vaccinated, they're passing on those immunities to the child. What happens when the baby's already out? Mom is still breastfeeding,
yes.
And some of that is inside of her body. Can this cause an issue, or is this a benefit as well to the baby?
No, this is certainly a benefit. We found that breast milk does contain the protective antibodies. Moms who are vaccinated, they while they are breastfeeding, and they are actually passing the antibodies, the protective antibodies, through the breast milk to the babies. At this time, we're not vaccinating babies. The studies are on the way, and hopefully by the spring 2022, I think the babies, it will be cleared for babies also.
Is that just because we haven't really had enough data on the children, and we were trying to rush just to get the adults vaccinated?
Absolutely.
All right.
Yes.
There have been some concerns, and this is just something that I'm thinking about now, of children getting potentially having greater risk now of falling ill from COVID because of new strains of the virus, something that's a little bit more aggressive than what we had seen before, where the
yes.
children were doing just fine. They weren't, they could get sick with it, but we weren't seeing them having the health complications that adults are having. You know, what is your concern, or do you have a concern when it comes to that?
And that's another reason why we should try and aim for that 70% vaccination rate in the U.S. because as to the date, we're not able to vaccinate children under the age of 16. But if everyone around them are protected, then obviously this will be a really added benefit, and they have less and less chance of being infected.
Let's talk a little bit about communities of color.
Yes.
There has been, as we know, already a great disparity in the rate of infections in communities of color, as well as those who are severely ill as a result of it. What have you seen in your study, in your practice?
I've been really pleasantly surprised by how open my moms of color to getting the vaccine.
Maybe it's because of you. It's the way you calmly talk to them.
It may be, and they, when they come back, and they do tell me that I was inspired to get the vaccine because of you. So that is a great feeling.
You have like a voice like a lullaby. Like, I really wouldn't mind you giving me, you know, a pap smear. I'd be like, oh, okay, everything's okay.
Thank you, Luana. That's very kind. Thank you. But I've really been very pleasantly surprised. Of my moms, right at the beginning of the pandemic, I just had a handful of moms that were affected. But as this whole year has gone by, I see up to now about 50 to 60% of my patients, they come in and tell me that they've tested positive, they've had the illness, and it isn't really predominantly, which has been a good thing, just for my patients of color. It's really been across the board. We do know, however,
so they're being more receptive to making sure that they're getting adequate health care.
Yes, I think that is the main thing. And they have successfully gone through the infections with support. Very few of them have needed hospitalization, and they've gone on to deliver healthy, bouncing babies.
That's the goal. We always want those good, healthy, happy, bouncing babies.
Yes.
For those who may have already gotten the infection, have the antibodies maybe in the body, why is it still important that they get vaccinated?
That's a great question, Luana. And the main reason for that is that there are so many new strains that are coming out now. We have the South African strain, we have the UK strain, and we know that when someone is vaccinated, that is a vaccine induced immunization.
Okay.
When someone is naturally infected, the antibodies that are produced are not as strong. So when they are exposed to the infection again, they are again likely to get infected. We know about reinfections in people who have already had the infection. So that is really important.
The antibodies can even wear off, I think, as early as just a couple months.
Yes. As early as 2 to 3 months. On the other hand, they sometimes do last longer, but my message would be that if you have had the infection, please go and get vaccinated again.
Dr. Talukder, why is this so different from, for example, the flu? You know, the flu, we're used to it. Maybe is it because since we're children, we are getting that vaccine year after year after year, so we're building up multiple antibodies. Why is it with COVID, it's a little bit more aggressive? It seems that way anyway. Am I wrong?
No, it is, certainly. We know that the flu vaccine and just getting influenza at different times of the year, it can sometimes result in death. But the thing about COVID-19 is that really is much higher. Catching COVID-19 and mortality rates are much higher than if you were just to catch the common flu. I do want to talk about fertility.
Yes, let's talk about that.
COVID-19.
This is important to me. I really want to delve in that topic.
Yes.
Because I'm older, and fertility is a concern and a fear of mine, being able to reproduce at some point. So let's learn.
Yes, no, absolutely. The COVID-19 vaccine, there with social media, there are so many myths out there. And this actually came about when two possibly anti-vaccinators in Europe, they brought a question to their equivalent of our FDA, the European Medical Board, and what they said was that the COVID-19 vaccine contains a spike protein called syncytin. Now, syncytin is something, an antibody that is very important for placental development and indirectly for pregnancy support. But that has not been proven. That has completely been disproven.
Okay.
The COVID-19 vaccine does not contain this spike protein, and as a result, you will not turn infertile. It is not going to cause you to miscarry.
I know that's got to be a big concern. Like I said, I'm older. I'm about 38 years old right now. I still haven't had children, but it is a desire. And I know there's a lot of women out there my age who are fearful and worried, is this going to mess up my chances of being able to have a child?
No, not at all. And it's not only for women. Some men, they have also voiced concern about the COVID-19 vaccine, that is it affecting sperm production. But to date, that hasn't really been proven either.
Could getting the virus impact fertility in the future?
No, it has, until now, the data that we have, it has not really shown that at all. Coming back to the COVID-19 vaccine, when it was given to pregnant, in the trials of the 44,000 people that were included in the trials, there were no pregnant women to start with who were actually included. But initially, 23 of them did get pregnant. So we at least know that yes.
it's definitely not going to stop that from happening.
So they did get pregnant with the just getting COVID-19 vaccine.
Do we know if there's a difference between Pfizer and Moderna? So many people saying, which one are you getting? Or is there just no difference?
No, there is no data to support one over the other.
I do want to stay on this topic of fertility. For those who are like me, a little bit older, a little bit concerned, what can we do now to ensure that when the time comes to have children, that we can have them safely, COVID or not? Is the risk now going up? Are there big changes now?
With COVID?
Well, just in general, I guess for women who are, there's more women out there who I think are like me. They have pursued their career. They've held off having the family part to ensure that this side of life is doing okay.
Right.
But we are concerned and worried about, will I be able to do this when the time comes?
Sure, no, absolutely. And you do that bring up a really good question. In the South, women, they traditionally, historically, have pregnancies and families much earlier. But on the East Coast, you're a baby because some women.
I'm not a rarity.
No, not at all. There are women who complete their careers as you are doing, and they even in their 40s they start contemplating having a pregnancy. And I trained in DC, and those women, 38, 39-year-olds, they start for a family. No, nothing to get nervous about. And
you could tell me I have cancer, Dr. Talukder, and I wouldn't be nervous just because of the way you deliver the message. I would be calm. I'd be, okay, well.
No, but
what should we do?
As you just have to stay as healthy as possible. The thing about conception, I've worked with infertile couples, and I find that the couples who are the most stressed, be it just trying for a natural conception, be it going through artificial reproductive techniques, the couples who are the most laid back, they are the most successful at conception.
That sounds like life.
Absolutely.
Just be laid back and you will, smoothly make it through life.
Yes. Just eating as healthily as you can, taking folic acid whenever you're planning on trying for a pregnancy. Folic acid is actually the only vitamin that's been shown to prevent neural tube defects, and neural tube defects are spinal defects that babies may have. So taking
as a result
acid.
Of coming from an older mother, or
no, not necessarily, just across the board. pregnancy in older moms, it can put you at a slightly higher risk of chromosomal or genetic abnormalities, but they can be, with modern technology, they can be diagnosed very easily with just simple non-invasive, what we call non-invasive prenatal testing. So just getting a specimen of blood from the mom instead of doing more invasive amniocentesis or chorionic villus sampling, we can actually diagnose whether the baby has any problems as early as 10 to 11 weeks of gestation.
That's so crazy how modern technology has really changed things from the time I was a child.
Absolutely.
When I think about fertility, I always think that it is going to be this expensive thing for me, you know, freezing my eggs. We know that that's another option. When should women begin to have that conversation with their doctors, and how does it really happen?
The freezing of the eggs, the sperm compared to a woman's ova or eggs are really much more resilient. So the eggs are so sensitive to any form of external manipulation or stimulation.
As opposed to the sperm.
As opposed to the sperm. They really don't fare as well during cryopreservation. My recommendation for those women is really to try and start as soon as possible. Anytime one is 35 years of age, our fertility does start to decline, and the preventing infertility really is to try and conceive earlier, sooner than later.
Do you go to a fertility bank to do this? They will manage all of that, or
yes, no, absolutely. There are. Are you talking about the artificial?
Yes,
reproduction?
for freezing the eggs. Is that just a conversation I would have with you, with the OB-GYN?
Yes, and there are reproductive endocrinologists who would be able to take care of that.
I'm trying to take care of all my medical needs with you. No, go ahead. I'm sorry.
No. I was just saying that if that is something that a woman would want to do, starting at an earlier age is beneficial.
So we talked a lot about the COVID vaccine, pregnancy, fertility. We know that there are no risks there. So definitely, to be safe, eat healthy. Fertility will do good as long as you're being a healthy and active person and being proactive with this vaccine.
Yes, no, certainly. As I keep emphasizing, giving every woman really the vaccine is the way forward. It's the light at the end of the tunnel.
Are you currently receiving or taking in any new patients?
I am.
Yes,
I am. Yes.
You want to be with this woman right here because she's just so calm and reassuring, which I think every person needs when they're going into their physician's office.
Sure. And my practice is OB-GYN Concepts, and I'm at Willis-Knighton Piermont, Suite 320, and the number to call is 318-212-2835, 318-212-2835.
All right, we have one more minute left. Really quick, Dr. Talukder, just kind of mention to me how passionate you are about what you do and dealing with your patient. I think that obviously I can tell just by talking with you that you have a great passion for women and for ensuring that they have the best quality of care.
Yes, no, I absolutely do. I'm a people person, and I feel that OB-GYN, obstetrics and gynecology is really the branch of medicine for me. It starts off as early as looking after 13-year-old as she is starting her reproductive life, going through all the different stages of a reproductive cycle with a woman, carrying through her pregnancy, delivering the baby, and then finally menopause. And that's what OB-GYN is about, really.
It was such a pleasure chatting with you.